Hey everyone, welcome back to Graft Academy. Today we're talking about one of the biggest concerns patients have after surgery: how to prevent infection after a dental bone graft. The good news is that infection after bone grafting is uncommon. When the procedure is done properly and aftercare is followed closely, healing is usually smooth and predictable. But because infection can cause discomfort and slow healing, it's worth understanding how it happens and exactly what you can do to prevent it. Let's start with the basics. A bone graft creates a protected space where new bone can grow. Your dentist places graft material, often under a membrane, and then seals the gum tissue over the top. During the first few days, that area is delicate. The body is forming a blood clot, new cells are migrating in, and blood vessels are starting to grow. If bacteria enter the site during this phase, infection can develop. The goal of aftercare is to keep that area clean, stable, and undisturbed until your body seals it naturally. So let's go through the main ways to prevent infection. First, follow your dentist's instructions exactly. This sounds simple, but it's the most important thing you can do. Every case is slightly different, and your dentist knows the specific details of your procedure. If you were prescribed antibiotics, take them for the full course, even if you feel fine after a few days. If you were given a special rinse like chlorhexidine, use it as directed, usually twice a day, to keep bacteria levels low. Second, don't disturb the graft site. Avoid touching it with your tongue or fingers. Don't lift your lip or pull your cheek to look at it. Even gentle pressure can open the sutures or loosen the membrane. Leave the area completely alone so it can stabilize. Third, be gentle when eating and brushing. Stick to soft foods for at least the first several days, things like mashed potatoes, smoothies, eggs, and soups. Avoid anything hard, crunchy, or sticky that could irritate the graft or push food particles into the site. When brushing, clean the rest of your mouth normally but stay away from the graft until your dentist clears it. If you were instructed to rinse, do so gently, no forceful swishing or spitting. Fourth, keep your mouth clean. A clean environment is the best defense against infection. Rinse gently with salt water after meals starting the day after surgery. Avoid commercial mouthwashes that contain alcohol. They can dry and irritate the tissues. Keep plaque away from the surrounding teeth, but again, don't disturb the graft area itself. Fifth, avoid smoking and alcohol. Both drastically reduce blood flow, which slows healing and increases the risk of infection. Even a single cigarette can constrict blood vessels enough to affect oxygen delivery. Alcohol interferes with the body's immune response and can also react with medications. If you can, stop smoking at least a week before surgery and stay smoke-free throughout the healing process. 6. Manage swelling correctly. Swelling itself is an infection, but if it becomes severe or lasts too long, it can trap bacteria. Use ice for the first 24 hours to reduce inflammation, then switch to warm compresses if needed. Keeping swelling under control helps circulation and healing. 7th, maintain good overall health. Your immune system is your best infection prevention tool. Stay hydrated, eat nutrient-rich foods, and get plenty of rest. If you have a chronic condition like diabetes, keep it well managed, as high blood sugar levels can slow healing and increase infection risk. Now let's talk about warning signs that may indicate infection. Pain that suddenly gets worse instead of better, swelling that increases after several days, persistent bleeding, pus, bad taste, or foul odor. These all need to be evaluated right away. If you notice any of those symptoms, don't wait, contact your dentist. Most infections are mild and easily treated when caught early. Another important point: not all discomfort is infection. Mild soreness, stiffness, or tingling sensations are completely normal during bone healing. The key is whether those sensations are improving each day or getting worse. Healing pain gets better. Infection pain gets worse. Dentists prevent infection by sealing the graft properly and using sterile technique, but your role is just as important afterward. Think of it as teamwork. The dentist provides the foundation, and you protect it while your body builds new bone. To summarize, prevent infection by following all post-op instructions, taking medications as prescribed, keeping your mouth clean but gentle, eating soft foods, avoiding smoking and alcohol, and monitoring for any sudden changes. If something doesn't seem right, it's always better to check early. It's quick, easy, and often nothing serious. With good care, bone graft infections are extremely rare, and your healing can stay smooth, predictable, and pain-free. If you found this video helpful, Make sure to like it, subscribe to Bone Graft Academy, and share it with someone who's healing from a graft or preparing for dental implant surgery. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.